I remember the first time I looked at myself in the mirror after having my baby and I could barely recognize myself. And I will never forget that moment at the grocery store and I sneezed, and that's when I realized something is very different with my body now. We all know the joys of motherhood, but these unexpected body changes can make you feel very self-conscious and embarrassing. So let's get real and talk about these 4 common changes, postpartum body changes after having a baby. Now, the first embarrassing body changes after having a baby is urine leaking. It is super common, but it feels like your body betrayed you. Have you had a moment where you wanted to jump on a trampoline with your baby or with your kid and you cannot hold your pee? Or have you had the moment where, okay, you need to go to the bathroom, but before you reach to the bathroom and sit down, you're already starting the flow of the urine? These are all signs that you have a weak pelvic floor. Now, with the weak pelvic floor, there could be a tight pelvic floor and a loose pelvic floor. So I commonly see these in my clients where it was a vaginal birth and it was suctions, or they had to use tools to have the baby to come out, or they had a really long and hard pushing phase where it took a while for the baby to come out. Actually, it was my example where my baby, it took many hours for my baby to come out, but the reason for that is because my baby was on an angle. The head was down, but it didn't come out of that hole it's supposed to come out. It was on an angle. So my midwife, actually, I'm a little bit graphic here, but my midwife had to put her hand inside to turn the baby's head so that it can come out. So it was a lot of traumatic experience and just the traumatic things down there on my own pelvic floor. And so I had a really weak pelvic floor that led me to have urine leaking after having babies. Or you could have a tight pelvic floor where it's shut tight down there. It's always, maybe you feel some pain down there, and then one day it's just starting to give up on you because you're squeezing it so hard all the time without realizing it. And then it gives up on you and you start leaking. This, I see it more often to moms who have never had a vaginal birth and they had C-section birth, but because throughout pregnancy, the vagina area has to shut tight, right, in order for you to hold on to the baby. The baby weighs a lot inside of you. And so it never passed through the vaginal canal. And so it's still shut quite tight there. And even after birth, you're still on that clenching mode after having the baby. And so it's clenched so hard and you never let it relax and contract. It should be fully relaxed and fully contract. And so one day it just starts suddenly becomes a urine leaking problem. And so these two are a sign, loose and tight pelvic floor are signs of a weak pelvic floor. So you need to work on strengthening it so that you can actually stop the urine leaking. And I know nobody wants to talk about this. Like, you're not going to bring it up to your friends. Hey, are you leaking? Or like, I'm leaking. Are you leaking? Like, it's something that's so embarrassing to talk about. And so here I wanted to share with you. Now, either way, you need to find out if you have a tight or loose. So the best way for you to find out is through an internal exam from a qualified women's health physiotherapist. So they will put their fingers in to test the strength inside to see if it's too tight or too loose. Now, once you realize that let's say it's too loose, so if you have a loose pelvic floor, you need to know how to contract and use the muscles again down there. So a Kegel exercises would be something that you can practice a couple of times a day throughout the week. So what Kegel really means is just thinking about lifting gently from your pelvic floor. So okay, if you're sitting on the floor or sitting on a chair right now while you're watching my video, can you feel a lift from your vagina? If I were to tell you to, okay, squeeze the vagina, can you squeeze it? And then if I were to tell you, okay, can you squeeze your area where you stop yourself from passing wind? Can you squeeze that area? Can you feel it let go when you want it to let go? Are you able to contract and relax? Now, if you're able to feel it, perfect, right? You continuously to do that movement until your situations improve. Okay, I'm just trying to simplify a way for you to do this. There might be some relaxation technique, breathing technique you can do about it, but I just want you to get the feeling of, okay, are you able to contract and let go? If you can, good. But if you cannot, then you need to learn how to contract, feel it, mind to muscles connect, and then let go. Now, on the other hand, if you have a tight pelvic floor, this is where I want you to focus more on the relaxation. breathing out, allowing your pelvic floor to relax and expand, allowing the pressure, your core abdomen, the pressure inside the core, allow it to descend down, and you inhale and then exhale and let go. So you need to, it's a two different technique, and I do have a video that I can explain more about that with the tight and loose pelvic floor that you can check out. But yes, definitely work on your pelvic floor so then you can have a healthy pelvic floor that you don't have to worry about embarrassing leaking. You know, you don't want to wear a pad at this age, right? You don't want to wear it forever for sure. Super common, but something that you should not be neglecting. Now, the second embarrassing body changes is back pain. Have you ever had a moment where, okay, you have to get off the floor because you were playing with your baby on the floor and you have to roll yourself, push yourself, pull onto something in order for you to get off the floor, or like you have to hold on to somebody, or somebody has to pull you up. You feel like you're a 60-year-old granny, or maybe in the morning when you wake up, you have to roll over and really push yourself, hold on to the drawer beside you in order for you to get up. So back pain really bothers a lot of people after having baby. And it could be postural issues because you are breastfeeding, you're always constantly hunching your shoulder and your upper back, and you're constantly feeling that there is a lot of tensions in your lower body, lower back body. Or it could be because you had a belly still protruding out a lot, and so your back is also constantly doing a lot of the work for you in order for you to be upright, in order for you to sit and stand. So it's constantly working for you. Back pain is such a subtle pain that only you can feel it. Like if I'm standing here, you're probably not going to realize I'm having back pain. Only you know, and it's just a silent killer. Like it kills your mood. Like no matter how much energy you wanted to have, no matter how much fun you want to be to play around with your body, if you have the back pain, it is just so hard for you to concentrate or play for long enough of time, and so really kills your energy. So don't neglect back pain as something that is common. It is common, but again, just like the pelvic floor, you should not be neglected. With the back pain, improving your postures by stretching and also strengthening your core muscles are the most important part. So stretching can include simple things like child poses. You breathe into your back, you allow yourself to expand, and so breathing is very, very important. So that will help you to stretch out the back. You can also do a wall angel where you place your back and face your back is on the wall, and then you put your hands like this, and then you slowly glide down the wall, touching the back is touching the wall as well as your arms slowly, so that you can open up your chest here and improve your upper body posture. Now, also functional movement is something that you wanted to be mindful of. If you're, let's say, picking up your baby from the crib or picking up a toys from the floor, how are you going to move that body will be important for your back, because you don't want it to strain your back more when you have back pain. So engaging your core, lifting your pelvic floor up, and then go down and pick up the toy, or like just bend your knees and go down to the floor, and then drive your knees up and use your hips to bring up your whole body. If you were to carry a baby, if you like hunch over to pick up the baby over the crib, really pull yourself and engage your core before you lift the baby, because the baby is still maybe not too heavy if they're newborn, but as they get older and bigger, it's going to strain your back even more without you even realizing it. Now, last thing is, if you are still working on your core and maybe you're earlier in the postpartum stage, having a postpartum belly belt would be really good for you to have, so that you can actually secure all the organs and your core, your loose core, and secure everything so that it's not constantly dragging yourself. So, then you can relieve some your back pain. As well as having a carrier. If you are having a carrier to carry your baby, instead of just using your arm and then, you're shuffling your hips on the sideway and then relying on your back. So that might aggravate your back pain, right? So having a good baby carrier to help you to take some load off your back will be super important. Now, the third postpartum body changes that no one seems to talk about, and it's very embarrassing, is that protruding belly. Do you still look like you are 4, 5, 6 months pregnant, even though you have gave birth a while ago, and your tummy still sticks out like you're still carrying babies? It's the most annoying ever. If you ever had anybody come up to you and ask you how many months you are, it crushes you. Like literally, you look at yourself like, am I this big? Am I still this big? No, I just had a baby like couple months ago. It's not a good feeling ever. Now with the tummy changes, and this is exactly everything kind of I talked about in my channel, is I want to make sure that you don't have diastasis recti. Still about 60% of women experience some degree of diastasis recti at 3 months postpartum. And if you don't know what diastasis recti is, it just means that there's a separation in your abdomen where your muscles are stretched and thin, causing a gap in the midline of the abdomen. So the wider the gap is, the more severe your situation is, as well as how squishy you feel. So if you have diastasis recti, it's not about just doing crunches or doing just general postpartum workouts. You really have to strengthen your core in order for you to look less pregnant, heal, and have a strong core. When you have a strong core, you can also have a strong back. So definitely core workouts, specific diastasis related core workouts to help you with it. I have lots of workout in my channel, so do check it out, and so that you can actually know, okay, what it is, and see. Also, just if you haven't know how to see if you have diastasis recti, you don't know how to self-check, definitely do a simple self-check here to see how many fingers gap you have, and also how deep your finger can go into the gap. So that's definitely the starting point there, and then check out some of the workout videos I have in my channel. Now the fourth and final embarrassing body change after having your baby is sagging breast. I know, they are so sad. Yes, the reason for the sagging breast is because of the huge amount of fluctuations in your weight from pregnancy to postpartum, as well as breastfeeding. The longer you have been breastfeeding, the more your breast has to be engorged in order to produce the milk, and it shrinks and engorges. So because of this long period of stretch and shrink and stretch and shrink, this is where, okay, when you finally stop breastfeeding, everything just kind of sag. So that exactly happened to me and many of my clients too. So what you can do about it is to apply lotions and like vitamin E's or hyaluronic acid to help to make sure that the area is supple. And then massaging, right, to make sure that the improved circulation. But one more thing I would say that is, if you're going to lose weight or if you're going to stop breastfeeding, try to do it gradually instead of like a cold turkey, so that you allow the skin to have time to catch up to the pace. So because if you are doing cold turkey, if you're like losing weight drastically, your body, the skin elasticity is not going to be able to catch up to the speed of you like doing everything so quickly. As well as some upper body exercises to help you to maintain a good posture upright. So that is also important for you, to not letting it look like it's sagging, because when you do have a stronger chest, you're able to uplift everything. The good news is that none of these changes are permanent. With the right steps, you can definitely reclaim your body's strength and be resilient and be the confident you. Yes, check out the video about how to do a simple self-check on your diastasis recti if you're not sure, or do a follow along workout video that you can find here or in the description box below. But if you do wanted to work with me one-on-one, creating a one-on-one custom program for you because you're postpartum or you experience diastasis recti or any of these changes that you didn't expect that you have, talk with me, have a consultation call with me at www.tummywarrior.com, and I'll see you inside. Bye!